A nasogastric tube, ING tube, is a type of medical catheter that's inserted through your nose into your stomach. It's used for limited periods to deliver substances such as food or medications to your stomach or to draw substances out. What is a nasogastric tube? A nasogastric tube, ING tube, is a thin, flexible plastic tube that's used for temporary medical purposes. Nasogastric means nose to stomach. The tube is designed to pass through your nasal cavity into your throat and down through your esophagus into your stomach. Healthcare providers use different types of nasogastric tubes to deliver substances to your stomach or draw substances out. Tube feeding. The ING tube can deliver special nutrition, as well as medication, directly to your stomach. You may need tube feeding, enteral nutrition, if you aren't getting adequate nutrition from oral feeding. This may be the case if you have a condition that affects your appetite or makes it difficult to chew or swallow. Sometimes hospital patients just need additional nutrition to support their healing. Some conditions that may require temporary tube feeding through a nasogastric tube include difficulty swallowing, dysphagia, head and neck cancers, altered mental status, unconsciousness, malnutrition, inflammatory bowel disease, IBD, endotracheal intubation, gastric suction. Your healthcare provider may use a nasogastric tube to draw contents out of your stomach, either as a precaution or as an emergency procedure. If you swallow poison or overdose on pills, they will pump the toxic contents out. If a medical condition or procedure causes your stomach to become overfull and distended, they will draw out the contents to decompress your stomach and prevent regurgitation. Some conditions that may require gastric suctioning through a nasogastric tube include toxic ingestion, poisoning, gastroparesis or gastric outlet obstruction, small bowel obstruction or pseudo-obstruction, intractable nausea and vomiting, upper GI bleeding,